In his latest Washington Post op-ed, Dr. Scott Gottlieb says that while the Biden administration's last-minute $306 million package to fight bird flu is welcome news, there's still much more to be done when President-elect Trump takes office. Joining us right now is former FDA Commissioner Scott Gottlieb. He joins us this morning. Of course, he's also a Pfizer and Illumina board member and a CNBC contributor. And Scott, let's talk this through. When we talked to you in the last week or so, you said you weren't all that concerned about bird flu becoming a huge threat for humans. Has that changed at all, that situation, or your take on this, since we've heard about the first human who died of bird flu?
No, that hasn't changed. I still think this is a low probability risk, but it could potentially be a high impact event and the kind of thing that we want to take steps to help mitigate. And there's things that we could be doing, things that we could have been doing, and things that we could do going forward to help reduce the risk that this could spread into humans. We need to be testing more on farms to turn over the cases, isolate cows that have become infected, and chicken flocks for that matter as well. Do more to help farmers protect dairy workers and be providing swabs so dairy workers can self-swab themselves and diagnose infections when those happen. The thing that you worry about is that people could become co-infected both with this virus and with seasonal influenza, and you can get a recombination between those two viruses that would enable this virus to spread more easily. That's, in fact, what happened in 2009 with H1N1. That was a recombination between the swine flu and seasonal influenza that happened actually in a pig, and then it became a pandemic strain. So you want to mitigate those kinds of risks. We also want to be doing more on the therapeutic side. We've stockpiled Tamiflu, but we haven't stockpiled the full range of antivirals that could be effective against this virus. And if you look at the New England Journal of Medicine, the case reports that were published 2 weeks ago on the two patients who became very sick, one in Louisiana and one in Canada, the strains in those patients became resistant to Tamiflu as the virus continued to progress in those two patients. And so you want to have Xofluza on hand. You want to probably have amantadine as well, the other antivirals that were given to those two patients. We haven't done that. So there's a lot that we could be doing to help mitigate this risk that we just haven't done, or we've done very late in the process.
Why do you think that is?
I think that there was a tug of war between human health regulators, public health regulators at CDC and FDA and other public health agencies, and state and federal agricultural officials that felt that this was going to burn out on the farms. They didn't want to take steps and interventions that were going to be costly and burdensome to the farmers, and so there was resistance. This is very structural, and it happens all the time between human health and animal health regulators. I had challenges getting my inspectors on produce farms, for example, when we had outbreaks of E. coli on produce farms, because they were reluctant to let federal regulators on those farms to do testing to try to isolate which particular fields were contaminated. And so you see this tension play out all the time. I think there really was a presumption among the animal health officials that this was going to burn its way through the dairy herd and it would eventually be extinguished. That hasn't happened. I think it's become endemic in the dairy herd right now, and we're also seeing it obviously in migratory birds. In fact, the two patients who became very sick, the patient in Canada and Louisiana, had the strain that's in migratory birds. And that's probably because, if I'm speculating here, but it's probably because they got sick by inhaling dried feces from the birds, and it got into the lower airways. So far, the infections on the dairy farms have been mostly conjunctivitis. It's not getting into the lower airways.
So do you think that the officials, the state and local officials who were, and the animal control officials have changed their mind about the concern level here? Or if they don't, is there anything that will get done?
Yeah, look, I think there are indications they have changed their mind, especially at state level. You see a lot of states doing very aggressive testing of dairy cattle. And you've also seen the implementation in just the last month, in December, of bulk testing of milk at a federal level. And so I think that was animal health officials recognizing that they need to take more aggressive steps on those farms. I think that the other thing we could be doing is increasing the compensation for affected dairy farms. The farmers should not be bearing the brunt of doing the right thing. They're on the front lines of this, and they shouldn't bear the economic brunt of doing the right thing, testing their herds,
Sure.
Isolating sick cattle or culling them, and also testing workers, providing testing for workers. When you have absentees because workers are sick from this, those farms should be compensated, and that way they have an incentive to turn over these cases.
Sure.